coming. It's an important issue. It's affecting a lot of young people, mostly young people, affecting and impacting in an adverse manner the quality of their lives. But on behalf of the County Commissioners Court, myself, and our Criminal District Attorney, Mr. Ricardo Rodriguez, our County Sheriff, Eddie Guerra, and our Chief Health Department Administrative Officer, Mr. Eddie Olivarez, we want to welcome you here today and to thank you for doing your part to help us get the word out to the community about what's going on. The Hidalgo County Health and Human Services Department issues a public health advisory on Friday of last week on the dangers of using synthetic marijuana. The alert was issued after the Health Department received reports of an increase in young adults and teenagers needing medical care for issues related to using synthetic marijuana. The problem is not unique to Hidalgo County. The Centers for Disease Control, the DEA, and the Poison Control Centers have reported significant increases in cases related to synthetic cannabis throughout the county. Joining us today are our Criminal District Attorney, Mr. Ricardo Rodriguez, our County Sheriff, and our Chief Administrative Officer. We've all come together united in our concerns for the safety of our youth and of our community and to raise awareness of the issue. We will commence this news conference with a statement from our Health and Human Services Chief Administrative Officer, Mr. Eddie Olivarez, but please hold your questions until the end of the conference.
Eddie? Thank you, Judge. Good afternoon, everyone. My name is Eddie Olivarez. I'm Chief Administrative Officer, Hidalgo County Health and Human Services. The primary reason we're here today is to discuss a very important situation that's occurring in our community. As you know, as our public health operations, we look at various illnesses, diseases, and overall health condition of our community. One of the things that just occurred in the last few weeks, the problem with synthetic marijuana has been in our community for a while, for a long time in fact, but most recently, the increase in concerns where our local hospital contacts us and says, Eddie, we're averaging about 2 to 3 cases a day in our ER rooms, as many as 25 or so cases in the last week. And the cases are severe. In some cases, the patients had to be intubated, get respiratory therapy and assistance. Some of them wound up in ICU. We've been working closely with our forensic specialist here in the county, she's actually confirmed 1 fatality in the last year involving synthetic marijuana and 2 other possible cases. But the cry for help from a local hospital saying we're seeing this in our ERs warranted the fact that after reviewing this with Sheriff Guerra, with Mr. Rodriguez, our DA, and of course with Judge Garcia, we felt that the best thing was to call action from our community, to put this as a component for our community involvement to get everyone to take a responsible course in dealing with this issue. One of the partners we have is the University of Texas Rio Grande Valley, who's been working very closely with us through our John Austin Peña Clinic. They actually have been providing some of these outpatient services to help some of these families. But the reality is the call to action is all of our responsibilities. Our local law enforcement, our school districts, our cities, our faith-based community, everyone needs to take a real active concern in dealing with this issue. You have a packet that was given to you. There's several website addresses, information. There's some documentation to help educate the community. The challenge that I put forward to everyone in the media and everyone here today is that you personally and your organizations personally take on the challenge to educate our community, educate our parents, push the awareness of the danger of this poison. Hear me clearly, this is poison. One of the biggest concerns is you get in contact with our poison control hotlines or numbers, the data, they get hundreds of calls daily from all over the United States asking for support and help in dealing with this synthetic substance. This is primarily, it's been labeled as an insecticide. It has been labeled as an industrial product, and it is shipped in by the tons into the U.S. and distributed to be used with the various substances that it is coated on, so they could inhale it via the various methods to inhale, either smoking, using bongs, electronic cigarettes, etc., that it could be used. I really want to stress the fact that the efforts from our partners here and all our partners together, this is an action that they are not alone on this. We need everyone. We need every single parent, every single community member, leader to stand up and really educate and be aware of the dangers of this product. With this, I'd like to call forward our Sheriff, Guerra, to come and give a brief overview from the law enforcement side, and then we'll hear from Mr. Rodriguez. Sheriff Guerra.
Thank you, Eddie. First of all, thank you all for coming to this press conference to help spread the message. First of all, I want to thank our health director, Olivarez, and our county judge for taking a leadership role in help getting this press conference together and put this public announcement together. Today, synthetic marijuana is sending more people to the emergency room than ever before. Synthetic marijuana is a mix of plants and herbs that are sprayed with chemicals. It is normally sold as herbal incense under the names such as K2, Spice, and other street names. It's actually very different than marijuana. Although it's supposed to give you the same high as natural marijuana, in reality, the effects can be very unpredictable. This synthetic drug can cause extreme anxiety, paranoia, seizures, strokes, and even hallucinations, sometimes leaving the user with the inability to speak. The truth is, we do not know the long-term effects that synthetic marijuana has on the brain and the nervous system. But we can tell you that with repeated use, the user can end up with memory loss, as well as psychosis, and as you heard the director say, even death. Today, anyone can walk into a smoke shop or a head shop and leave with a legally purchased synthetic drug for less than $30. This drug can even be purchased over the internet. But just because it is legal to purchase does not mean that this synthetic drugs are not dangerous. Ladies and gentlemen, synthetic marijuana is a very, very serious situation, and it's very dangerous. For this reason, the Sheriff's Office Crime Prevention Unit is continuing to raise the awareness of the real dangers of this substance. At the same time, our patrol deputies, in coordination with our narcotics unit, continue the effort to take these drugs off the streets. This year to date, I can tell you that nearly 100 people have been arrested by my office for either possession or in dealing synthetic marijuana. And understand this, the Sheriff's Office realizes that synthetic marijuana is a growing problem, not only in Hidalgo County, but throughout the nation, and we will not cease our efforts to combat this problem. Before you, we brought in some of the evidence that we have taken off the streets, and you'll see some of the various packages that this substance is produced. I can tell you that most of these products come from China, with a chemist over there. Again, it's an herb, and they just spray the chemical, much like an insecticide, on these on the herbs to give you that high, and you know, putting that into your system, you don't know what's gonna transpire. Different people have different effects. It affects people differently. We're noticing that this product is very, very popular in the high schools because It is very rarely when they do get tested for drug use, it doesn't come out. So it's very, very popular. We have worked with our school district PDs, and most of the information that we're getting comes in from our Crime Stoppers hotline. We urge our media partners to put out that the samples. That way the parents know what it looks like, how it's packaged, and call our Crime Stoppers hotline if they want to remain anonymous. Thank you.
Thank you, Sheriff Guerra. I'd like to call forward Mr. Rodriguez, our County DA.
Good afternoon. Thank you, Mr. Olivarez, Sheriff and County Judge Ramon Garcia. Obviously, you can see that this is a unified effort from all of us, not only to the ones that are here today, but all the county. And I'd like to thank the media for being here as well to help us bring an awareness out to the citizens of this county. Every crime that's committed here in Hidalgo County that has an effect on our citizens is of an importance to us. Obviously, prosecuting those cases. But anytime we have a crime that's being committed here in the county, especially this type of crime, where we have the sale and use of synthetic marijuana, a dangerous and poisonous drug, it's more of a concern to us because it's affecting our children here in the community. And I am proud and happy to be here to make sure that we send out the message to everyone who's out there, our teachers, our administrations, our parents, that we do have a problem with synthetic marijuana. And as Mr. Olivarez mentioned earlier, we're seeing more and more of these type of cases, some that are being arrested and possibly prosecuted, and then some that are being known of when these individuals make it to the hospital and they're in serious conditions, or there's serious conditions to them. Now, we've seen cases where individuals have passed, maybe not here in the county, but all over the state of Texas, because of the effect of synthetic marijuana. It's a very, very dangerous drug. Just like some articles have mentioned, it's no different than playing Russian roulette with this type of drug. And we have to be cognizant of, and we have to be aware that it is a serious problem, and this drug is being used by many, many individuals here in the county and in the whole state of Texas and the whole nation. So I'm asking everyone out there to be on the lookout for these type of symptoms that are usually symptoms when using synthetic marijuana. We have high blood pressure, heart palpitations, nausea and vomiting, muscle spasm, seizures and tremors, intense hallucinations, psychotic episodes, even death, as I mentioned earlier. So as a district attorney, I am here to send a message out and tell the citizens of the county that we will do everything in our power to make sure that we prosecute these cases because, again, it's a dangerous, poisonous drug that's affecting so many of our children out there. And I commend the sheriff and all law enforcement agencies that are out there working and trying to find these dealers who are selling these type of drugs that are hurting our children in our community. Yes, we're concerned about the consuming, but we're also very concerned about the vendors that are out there that are selling these drugs. And again, I commend all law enforcement agencies that continue to work to find these individuals so there could be an arrest made and also possible prosecution here at the DA's office in Hidalgo County. And again, I want to thank the county commissioners, the judge, Mr. Olivarez, and the sheriff for being here, and of course the media as well. Thank you very much.
Thank you, Mr. Rodriguez. One of the key things here is that, again, it's very common when we talk to the school districts that you hear young people say, well, Mr. O, it's natural. It's all natural, it's good, it's from the earth, there's nothing wrong with it. Hear me clearly, there is nothing natural about this. The main medium they use may be natural, may be an herb, but what it's laced and coated with is 100% industrial chemical. It is dangerous, it is deadly, and it is affecting hundreds of children in the community. With that, I'd like to, where's Julia? I'd like to open up for questions. Julia, or do we do closing? Questions?
No, let's go ahead and go ahead, Lorenzo.
Question to Sheriff Guerra. What active steps are you taking to ensure the product doesn't end up on shelves? And have you identified locations, places where these are being sold, and what's being done about that?
Well, currently, the law, the way it reads today, if you look at the packaging on these on this product says for non-human consumption. So it is not against the law to have this product sold as like I mentioned as incense. It's when it's being used, it's being consumed. If we have information where a certain dealer is or distributing this, like for instance an apartment, well we know that his intent is not to sell that as a herbal product. He's selling it as a drug. So currently we're currently working on active tips. We have made this year, I can tell you, we've made 2 substantial arrests on some major dealers or distributors of this product.
But follow-up to that is, clearly, like it was mentioned, this is in the high schools, it's at schools. What's been your coordination or collaboration with the school police departments, and what has been the feedback from them?
Well, we get our information from our partners in the schools that lead to those tips, the locations where these individuals are marketing and distributing these products from. We set up surveillance, and then we do buys at these locations, and then we get a search warrant or we do a consent.
Okay, Greg?
Yes, Sheriff, I was just going to ask why I haven't really seen any big busts per se. You know, we see every week 100 pounds of marijuana busts and so forth. But so from what I understand is if my pickup truck outside were full of this stuff right now, it would be perfectly legal as long as you couldn't draw a direct correlation between what I had in the truck and my intent to sell it to someone, let's say.
Well, we'd have to get that intent of what you're going to intend to do with the product in order for us to build a case on it. But if I had it in my truck outside, it would be legal. Yeah, because if you're a owner of a smoke shop or a head shop, then it would, you could make the argument to us that you're selling it for incense.
Sure. Okay, go ahead.
What do you attribute the increase to? Is it because it's easily accessible? Is it cheap? It
is easily accessible, and what we're being told from our narcotics unit is that these individuals know, they tell us that they're using it because they can, if they do happen to get tested, it's not going to show up as an illegal substance. So, in one case, one dealer is recruiting females in these local high schools to sell to the males. So it's a constant problem for us. And but we are partnering with our school district, La Jolla ISD, Edinburgh ISD, being the 2 biggest partners that we have with this program.
Is there any restriction on the amounts that any given shop can sell these?
No.
No.
There's no age limit either.
Anybody can purchase this. There's no age limit. As far if you're gonna burn it, for instance, it's totally legal. And now there are, from my understanding, Texas does not ban it, but there is 43 other states that do have statutes banning the use of this product as an herbal incense in their state laws. But currently Texas doesn't have that.
But what's happening is that they're taking these items and this substance, And what some are doing, they are doing it, is they're using it and putting it on, for example, could be marijuana, and they call it lacing, and they're using the substance and putting it on marijuana, and for it could be that whoever's purchasing, who thinks they're purchasing marijuana, it's not marijuana. It's actually marijuana laced with this product, which is a poison. Obviously, any drug is bad, but it makes that marijuana even worse when we have someone who's using this product, lacing it, and selling it as well.
Oh no, I'm sorry, you were next.
I was going to say real quick before the question, what the sheriff and Mr. Rodriguez, the DA, said is accurate. For parents, it may be the legalities in question. I understand that. But there's a lot of other issues that consumption of a substance is labeled insecticide, consumption of a substance that is not for human consumption, when it's causing a mood-altering effect, any parent, any school, anyone, that is a vital concern to the child's safety and concern. So to us, it's looking at it from a community safety, awareness, and concern, to the point where this is something that I usually, as a health department, don't monitor, but we've actually developed a surveillance component through hospitals that we're actually starting to track all those numbers on this. This is something we've started recently because it is becoming a community health issue, and it's a great concern to us.
So it's no different than buying antifreeze at a store, which is perfectly legal to buy, but using that antifreeze liquid in a way where it's being consumed or sold where it's affecting the person. So that's no different than this product here before us or that's being sold.
Okay.
What are the areas of beer incidents here in the county?
We're finding it throughout the county, from Hargill all the way to Sutherland City to Mercedes.
Is there any number of cases?
The only cases that I researched for this press conference is from January 1st. I can tell you that we've made 99 arrests for possession and the intent to distribute. For the intent, I'm going to say there's probably a dozen for the intent. The rest were for possession.
And what happens also during the arrest is there's individuals, younger individuals, who give us this information and tell us exactly how this product is being used and helps in the investigation, also in the arrest.
But that's only for my office. I mean, we have 21 different municipalities, of course, the state agencies, and the constables also making arrests for this offense.
There's a question of legality, you outlined that, but I know of cities and other counties who have outlawed these specific, they're targeting these products so that they can make it illegal, so that then they can go ahead and make these bigger busts. Is there a push by the county, the district attorney's office, to make that a point of maybe that there's legislation that needs to be put in place? Is there anything on that front at this point?
I mean, obviously, it's a concern that we are going to voice our opinion and concerns to our legislators. You're correct that many states have banned these types of products. The state of Texas has not banned these products. So,
but with that said, Raymondville, I know there's a city ordinance there where they've actually arrested a Edinburgh patrol officer recently.
There's 3 communities in the 4 counties in the Rio Grande Valley. The community of Raymondville, La Grulla, and Rio Grande City actually have ordinances against the sale of these products in their communities. However, that is a governance issue that needs to be discussed at the local level by the local elected officials. That's at that local level. At the state level, I assure you that these gentlemen here have this community safety always in mind and the best interest of the children of our community. I know they're talking to the legislation, to the legislative officials, to make sure there's changes in the future. But the problem with this chemical, and I want to say it's a chemical, is that it is altered slightly, and the different variants of it then becomes a legal product. It may be illegal in state by a certain chemical name and compound, but once you alter one carbon atom, one molecule, it becomes a different chemical, and now it becomes legal again. So it's a very, very legally complicated thing to do. So it's not an easy fix.
And you're right, I mean, it's not an easy fix, but the states that have banned it have a long list, a 400 long list of different products that are banned that then would make it illegal to have any of these in any compound combination. Is there an idea of maybe talking to local city leaders and explaining that that's probably something that they may want to do if this is a community concern?
Well, I think that's the message we're here for. The message we're here for is to challenge everyone that's here today, taking this media, this video, all of you. It's not R3's responsibility, it's the entire community's responsibility. Everyone in the community needs to take an educational prevention awareness component to this. Educate your children that this is dangerous. Parents, become aware of it. Your packet has various websites, information in English and Spanish to help disseminate that out for us. Help us disseminate the educational piece. Very important. Then the other part, when it becomes a policy issue, we'll leave that to the people to develop policy. But right now, the key effort is if we get the community involved from an education, prevention, and intervention point of view, that is a huge first step. And that's what we need your assistance with, is that community awareness.
You mentioned that the last question, okay? You mentioned that it may cause death. Has any persons died here in Hidalgo County due to this?
We've had one case that has been, we've had possibly 2 cases already that have had death due to complications from this substance. And it affects the pulmonary system tremendously. It actually makes your alveoli and your lungs rupture, and you actually will practically drown in your own blood from it. It will cause renal failure. Your kidneys will stop working. You'll have to be put on dialysis. And we've had several people in the ER rooms who have been put on ventilators and in ICU. This is extremely serious, folks. This is, again, a poison. This is not a recreational drug to be considered as some kind of fun thing. This is deadly poison.
And what the director mentioned, some of these youth tried it for the first time, and this happened to them on their first hit of this substance, and some of them have gone into a coma.
Sure. And we're asking that the community, the citizens, students, everyone, if you know of this going on somewhere, please contact your local law enforcement agency. Please contact the county, contact the municipality, contact someone at the state level, contact the DA's office. Please contact someone so we can address it, and again, we can end and stop this.